research by providing facilities, giving grants, and facilitate funding. Someone that does research for us, we are standing to say we don't need the person's intervention? No! We need WHO's intervention. In the aspect of training, WHO has the largest fellowship program of it holds about 1,000 fellows per year, and about 120,000 fellows are being trained in that fellowship program. Do you know WHO has increased the percentage of medical personnel from 44% to 53% in the rural areas, and from 75% to 84% in the urban areas? That's my source is the WHO's webpage under the health workforce. Now, monitoring. WHO actually puts pressure on the health ministries of various countries to monitor them in order to implement policies and programs. These policies and programs help this country in achieving their goals. Standardization. WHO will be able to standardize medications, medical equipment, medical training, even standardization of our products for both local and international use. For Africa to achieve its Millennium Development Goal, WHO plays a key role in that. So the role of WHO cannot be emphasized when I say we needed them in the past, we need them now, and we are still going to need them. Thank you.
My name is Mamudu Aminat Omoyeme, representing Nigeria's premier private university, Igbenedion University, Okada. I am here to strongly oppose the motion which says that African countries are far better off without the intervention of the World Health Organization. Since its initiation on the 7th of April 1948, the World Health Organization organization's mandate is the improvement of health. This it does by the following points. Number one, reduction in child mortality. The WHO has been able to achieve a 49% reduction in child mortality from 90 deaths per 1,000 live births to 46 deaths from 90 deaths per 1,000 live births in 1994 to 46 deaths in 2013. Are you telling me that the World Health Organization this intervention is not needed in Africa? Then coming to humanitarian intervention, the World Health Organization provides humanitarian services both during times of normalcy and in times of crisis. In times of normalcy, they provide access to safe drinking water as well as providing guidelines for basic sanitation. And in times of crisis, do you know that the WHO has been able to provide protection to over 700,000 refugees who fled conflicts from Mali, Democratic Republic of Congo, Sudan, and even coming home to Nigeria? They provided protection to internally displaced persons in Nigeria. Africa would have been worse off without this intervention. Then coming to the issue of immunization and vaccine development, the World Health Organization has been able to pull together experts from different parts of the world to develop and revise recommendations on the production and quality control of vaccines. This intervention has gone a long way in preventing over 3 million deaths every year. A very good example is the over 90% reduction in measles-related mortality. Africa definitely needs WHO's intervention. Then coming to the issue of elimination of unwholesome cultural practices in Africa, the World Health Organization has gone a long way to eliminate unwholesome cultural practices in Africa. A very good example of which is female genital mutilation. This has gone a long way in improving the overall health of the girl child, as well as eliminating patriarchy and creating equality between the sexes. WHO and economic development. You may ask me, what is the relationship between WHO and the economy? Is WHO a financial organization? No, it's not. An ill man is an unproductive man. WHO strives to ensure a healthy populace. A healthy populace increases productivity, and increase in productivity leads to stronger economies. Health lays the foundation for vibrant and productive communities. Strong economies save nation, and Africa is not better off without WHO's intervention. Thank you very much.
Standing on the existing protocols observed by my first speaker, I am Yemen Trace representing Igbenedion University, Okada, and I stand here strongly to oppose the motion which says African countries are far better off without the intervention of WHO. It's often said that you don't know what you have until you miss it, until you miss it. But I start to realize that we don't know what we are missing until it arrives. And the arrival of WHO in Africa has proven to Africa that we have missed a lot of things in the past, and we are still missing some things if we say we don't need their intervention. With this, I back up with my point, saying the WHO intervention in the neglected tropical diseases. These are diseases that ranges from sleeping sickness, night blindness, and even the guinea worm disease, which is very dangerous and has silently killed lots of Africans. And according to the World Health Organization report 2008, it was stated that the overall mortality from these diseases were reduced by 90%. I mean 90%, almost 100%, to show that WHO has intervened and these diseases were removed from Africa. Also, talking about the improved maternal health, which is a permanent obligation on which the WHO has taken upon themselves to improve maternal health care, ranging from childbirth complications that we see everywhere in Africa. According to also WHO report in 2005, using the Save Motherhood initiative, they have been able to reduce the maternal death from 400 deaths per 1,000 women to 210 deaths per 1,000 women. With such great advancement, we stand to say we don't need WHO intervention. I would also like to point on the aspect of the transparency in health sectors. Most of these health equipments and services do not get to the masses as they should, but WHO has stood as a body to make sure that these services and equipment get to the masses and people get to use these services the way they should. I'll conclusively talk about in protocols where WHO has set basic guidelines. I tell you, there will be no medical procedure that will be effective without following basic guidelines. If not, you'll be risking the life of someone. But the WHO will make sure that these protocols are set, and as we follow them, it has helped Africa a lot in achieving lots of our medical goals. With this, I say Africa cannot be better off without WHO's intervention.
It is a little observation. The first speaker spoke about Ebola outbreak and how the UN helped humanitarian health sector to combat it. I will advise you do a research on that. The credit was given to Nigerian health sector with Lagos State health sector. I do not think that the UN or the WHO was at the helm of affairs in combating Ebola outbreak in Nigeria. Thank you.
Pacific Trip from the University of Ankara. The first speaker talked about eradication of smallpox. In the 1970s, I believe eradication was the term used in the fight against Ebola. Indeed, it went off the grid for about 2 decades. We would have called same viral infection an eradicated disease, if not for its reoccurrence last year. Therefore, in what terms do you define eradication considering these 2 incidences? And how sure are you the diseases you have termed as eradicated will not resurface in the nearest future?
On the first speaker, I would like to clarify what I said. I said the United States Disease Control the United States Control Disease Center and Prevention, along with the World Health Organization, as well as the Nigerian Center for Disease Control, helped in the eradication of Ebola. I never said the United Nations. Secondly, eradication. Eradication, something can be eradicated but not extinct. In the sense that eradication, I meant in that context, is transmission from person to person after checking people that have been in contact with that person, be it a communicable disease, and checking the incubation period of that disease to know if the person that has been in contact with an infected person shows any signs and symptoms. When there are no reported signs and symptoms within the period of incubation, even more so times 2 the period of incubation, that is termed eradication, but not extinction, because depending on the causative organisms, some organisms can stay extinct till they find a proper host. Thank you.
The next to come on stage is Nigerian Topic 9 University. Again, the topic, the Nigerian health sector has benefited from the United Nations Health Program. The Nigerian health sector has benefited from the United Nations Health Program. They are against.
Yeah, good evening, Mr. Chairman, panel of judges, timekeeper, the moderator, co-debaters, distinguished ladies and gentlemen. I am Olamide Aitalegbe, representing Nigerian Turkish University under the Department of Political Science and International Relations. I'm here to oppose the motion which says that the Nigerian health sector has benefited from the United Nations health programs. The United Nations have not done enough in the eradication, alleviation, and even addressing of the malaria parasite itches confronting Nigerian society. The main fact that the United Nations have not done enough in helping developing countries, for example Nigeria, to benefit from the health programs is encapsulated in a sentiment got from an Al Jazeera blog that says that the United Nations spend more time in organizing red carpet dinners and shows with African leaders rather than combating the epidemics confronting their society, of which Nigeria is a part. Malaria is the leading cause of morbidity and mortality in Nigeria. It is responsible for the death of over 300,000 children under the ages of 5 in Nigeria annually. People of all ages have regular attacks of malaria throughout their lifetime, but the disease and burden of death falls mainly on young women and young children and pregnant women. Malaria is the leading cause of morbidity and mortality. It also has a direct effect on growing cases of poverty, low productivity, absence from work, low school attendance, and also it affects immunity to other diseases in the country. And as we are here now, I myself, I'm also suffering from malaria fever, and I'm still undergoing treatment. So how on earth can you tell me that the United Nations is working? How on earth can you tell me that they are supplying the facilities needed by us? In Nigeria today, the mosquito-borne illness also contributes 60% of public health expenditure, 30 to 50% of inpatient admission, and also 50% of outpatient visits in endemic areas. Efforts by the federal government to curb this disease has yield little or no results due to the structural and behavioral barrier by citizens. And this goes to show that the UN is not taking seriously their mandate to acquaint people living in rural areas about malaria. The private health sector contributes 60% of the health facilities used in treating malaria and other health-related issues in Nigeria. Yet, you tell me that the UN is working? No, they are not working. If the private health sector can contribute 60% of the facilities used in treating malaria, I don't think they are working. And what the bone of contention, why we are opposing the efforts of the United Nations, is that we've had malaria with us for a very long time. And malaria is still with us. It's ravaging the streets of Nigeria, and the death toll due to malaria is still increasing. And instead of the UN to do something about this, they are blindfolded. It seems they are not concerned about our welfare, so to speak. The Western pharmaceutical stores and hospitals in Nigeria are used as conduit pipes for extracting millions of dollars from the Nigerian health sector. To illustrate, the average Nigerian lives on just $1 per day, while there are fixed prices for these drugs on malaria, tuberculosis, typhoid, and other health-related illnesses are above $6. The price for HIV retroviral drugs runs into millions. It was even the Nigerian government that tried a bit in subsidizing the funds spent on HIV retroviral drugs. And yet, you tell me that the UN is working. The World Health, how on earth is the average Nigerian who lives on just $1 supposed to afford these drugs that are above $6 a day? The World Health Organization, as an health segment of the United Nations, is supposed to mount serious pressures on these Western pharmaceutical stores to reduce the prices heaped on these drugs so that it does not become a burden for the average Nigerian to afford them. The malaria states, the action program on malaria by states by Mr. Dominic Usman, the communication officer from Benue State, said that our country, Nigeria, has recorded over 100 million clinical cases of the disease malaria annually. And some preventive methods or measures that can be used in combating and treating this illness is the genetic engineering of mosquitoes. This encompasses injecting the mosquitoes, making them sterile, then sending them out to mate with other mosquitoes, thereby killing them. This is attacking of the malaria vectors. Another preventive measure will be to spray stagnant water treated with chemicals in environment with high risk of malaria infection. This is attacking of the malaria parasite. Now, this approach has been used times without number in the Western world, and its positive effect has been tremendously great. And here we are in Nigeria, the UN has not used it in eradicating malaria and other health-related issues. In a statement issued September 2008 by the Public Information Department of the UN, an estimated 250 million nets were to reach 80% coverage in Nigeria. Till date, the funds committed could only provide less than one half, precisely 100 million nets. Where are these nets? Why is that people are still dying in the rural suburbs of Nigeria? Why is that most households in the rural suburbs of Nigeria do not use or even have mosquito nets? Because it shows that the fact that the UN is not seriously working. Yet again, another question. The UN has a branch in the United States where they have their workers working tremendously well, and where these other diseases and malaria have been curbed to a great degree, giving preventive adequate mechanisms and adequate cure. And these diseases are no longer in their country to a very high rate. And here in Nigeria, we have UN workers where they claim to have put in so much funds, where they claim to have helped Nigerians to benefit from their health programs, and yet people are still dying. Do you call that benefits, please? Thank you very much. HIV/AIDS. In 2011, the UN made a promise to curb HIV/AIDS by 80%. In 2012 now, in Nigeria, we are now in the year 2015, and there are 1,000 new infections of HIV/AIDS recorded daily. The health facilities used in Nigeria reported, in 2012, reported 8.3 million deaths caused by malaria. Now, 2015, there are 100 million clinical cases of malaria in Nigeria. Do you call that benefit? Lassa fever. 5,000 persons die yearly of Lassa fever, and there are over 300,000 infections reported yearly, new infections. Do you still call that benefit? Tuberculosis. Nigeria has one of the highest tuberculosis burden in the world, and there's 311% deaths of every 100,000 tuberculosis cases recorded in Nigeria, says USAID. Once again, I ask, is that benefit for crying out loud? No. We know that the government has to do all of this, but the very contention why you're still opposing the UN is that the UN has a status and a reputation for being #1 global health leaders in combating health-related issues, and they claim to have a reputation for this. In a reputation, they should show what they are worth, because what is worth doing is worth doing well. And so they should put in their best to eradicate malaria and all these other illnesses from our side. This is a pointer. Look at the increased rates of death caused by this disease in Nigeria. This is a pointer to the fact that the UN is not properly funded or well equipped to combat malaria and other health-related issues in Nigeria. But also perceive failure on their part as global health leaders. I hope at this point I'll be able to buttress my point, jettisoning any iota of doubt, if any, that the UN as global health leaders has not been effective in the Nigerian health sector, and that the Nigerian health sector has not benefited from the United Nations health programs. Thank you.
Good day, Mr. Chairman, panel of judges, timekeeper, moderator, court beaters, ladies and gentlemen. My name is Bamai Muhammad Fatima from the Department of English Studies, Nigerian Turkish University. I am opposing the motion that the Nigerian Health Center has benefited from the United Nations health programs. My opposition to the motion is based on the motion that the Nigerian Health My opposition to the motion is based on the background that the United Nations has benefited, the Nigerian health sector has benefited from the United Health programs. It will be recalled that the recent Ebola outbreak in Nigeria on the 20th of July 2014 occurred when a certain Liberian man, Patrick Sawyer, either consciously or unconsciously brought the disease in the country. With the announcement of the Federal Ministry of Nigeria that the disease is resident in Nigeria and it's now penetrating the Nigerian population, especially those residing in Lagos. One ordinarily will expect the immediate response of the World Health Organization as a body charged with the duty of combating global health issues to come to the rescue of arguable African most populated country immediately. That was not the case. The UN as global health leaders failed Nigeria on this instant. During the Ebola outbreak in Lagos, the World Health Organization and other partner organizations were quick to convene an emergency meeting to declare Nigeria among other 10 countries with Ebola virus. This internationally brought about international discrimination from the Western world to Nigeria in diaspora as hosts and carriers of the deadly virus. It will be recalled that Vincent, the Super Eagle goalkeeper, was made to suffer was made to suffer high-profile level of discrimination in France on his return from Nigeria during the period of Ebola outbreak. It's a common knowledge that the United Nations refused to give drugs to the UN. It is a common knowledge that the UN refused to give drugs to the Nigerian patients that is suffering from Ebola that is used in treating the Western patients. This is a failure on their part. I still remember vividly that it took the combined effort of the Federal Ministry of Health and Lagos State Ministry to eradicate and combat the disease in Nigeria. The United Nations health workers and the international workers, and of which United Health Workers are in Nigeria, trying to learn how the Nigerian health sector has been able to eradicate and eliminate the virus. Nigeria is still considered among the countries which high level of maternal and infant mortality. This, in most developed countries, this has been eradicated Why is Nigerian case different? It is on this background that I will pose the motion that the Nigerian health sector has benefited enough from the United Nations programs.
Mr. Chairman, panel of judges, timekeeper, the moderator, my co-debaters, distinguished ladies and gentlemen. I am Unifade Morenike from the Faculty of Law, Nigerian Turkish University, and I am here to oppose the motion that the Nigerian health sector has benefited from the United Nations health programs. The impression the United Nations has had thus far is of #1 global health leader in combating, eradicating, and alleviating various global health challenges. The impression the average Nigerian has on these global health schemes is that they are for big men and oimbos. In 2011, the UN made a promise to curb HIV and AIDS by 80% in 2015. And this is 2015, and each day there are 1,000 new cases of HIV in Nigeria. About 3.7% of Nigerians are still living with HIV and AIDS. This population grew from 3.4 million to 3.7 million between 2011 and 2015. The question therefore is, if the United Nations are doing their jobs and these programs are working as they should, why is there an increase in the population of people living with HIV and AIDS in Nigeria? The efficacy of these programs, therefore, is in doubt. The UNAIDS Declaration Program of 2010 was that by 2015, they would have reduced sexual transmission of HIV in youths. Universal access to retroviral drugs should be provided. To achieve this, they tried to eliminate HIV-related restrictions in some states and some countries. They also have zero tolerance for gender-based violence, and among other things. The awareness level of HIV and AIDS in the suburbs and the rural areas appears to be on the lower side. Their strategies have not reached the point where a higher percentage of Nigerians will have the conviction that the best way to combat HIV and AIDS is total abstinence from premarital sex. Many non-governmental organizations, of which I will not mention, have written proposals to join the campaign against HIV and AIDS. It appears, therefore, that the UN has not monitored these proposals that have been given to it. Therefore, it is proof that money has exchanged hands, and yet little or nothing is being done to curb this disease in Nigeria. The UN strategies have therefore become platform for self-aggrandizement for these few individuals who can write lofty ideas. It is not enough for partner NGOs to organize big events in luxurious and expensive hotels, all in the name of fighting HIV and AIDS. I am of the opinion that the awareness campaign should be taken to the grassroots and participating measures should be taken to curb the HIV and AIDS. Thank you.
And the lack of political wish to implement some of these programs and policies of government, and even policies coming from outside the country. How do you think the United Nations Health Program can make impact in our health sector with the level of corruption and lack of political? Thank you. You just note that.
Okay.
We want to ask any of you.
My name is Chris Wogu. I'm the Program Director of Citizens Advocate for Socioeconomic Rights of Nigerians. I want a little bit clarification. I don't know if we are talking about African countries in general, or we are talking of Nigeria in particular. Because what I got here initially was African countries are far better off without World Health Organization intervention, something like that. And now we are discussing Nigeria in particular, and that's why we are narrowing to malaria, TB, and so I want clarification in that. And also I want to know why the non-governmental organizations cannot be mentioned if it's authentic. Thank you.
Your speech, you seem to place a lot of emphasis on the fault of the UN in not curbing HIV and AIDS and malaria. How much responsibility do you think the UN holds exactly in Nigeria to curb those diseases? Because you seem to put a lot of blame specifically on the UN alone. Thank you.
I'm Odupaya Adito, and to Mr. First Speaker, we are good students of international relations. Firstly, I want an understanding that the United Nations can only pay. They directly have no responsibility to any country whatsoever. Secondly, let's say you totally neglected the fact that the WHO is still in conjunction with the United Nations. So your first argument should be eradicating and bringing out the failures of the World Health Organization so that you can bring the UN to justice. And thirdly, in the case of Ebola, it would have been very wrong and destructive for the United Nations to permit the dispensation of a drug that was not fully tested. The cola nut test worked on that man because his body metabolism worked with it. If they tried it on somebody that it worked against, it could have been worse because the UN will not be charged for admitting a drug that has not gone through proper testing. So please let's have facts correct.
The first question on corruption. It's now common knowledge that corruption is a part of the system, even though something that is not of an advantage. The United Nations, we might not have a straight responsibility. It may not be the government who is supposed to provide these facilities or who is supposed to help in eradicating this thing, but they have a reputation for being number one global health leaders. And looking at the fact that it is their duty to make sure that these funds get to the proper places, it is better they use, or just like in the case of the election, international observers were used in coming to observe elections and all that. They can also use Westerners as good channels of distributing these materials to places where they will be needed. For the issue of the mosquito nets, they can educate the government or aid the government, so to speak. They should aid the government in helping people at the rural area, at the grassroots, to benefit more from their programs, to benefit or get acquainted with knowledge on how to handle malaria issues. Then, talking about the second question on the issue of the case study being narrowed to Nigeria. We are opposing the fact that the UN has not done enough in helping Nigeria to benefit more from the health programs is encapsulated in fact that apart from the fact that children die yearly in Africa, we are narrowing this down to Nigeria to show that Nigeria as a whole does not benefit from the United Nations health programs. How much more talking of Africa as a whole? Nigeria, you look at rural people in the rural setting, they are destabilized, so to speak. So there's no way you can say that the United Nations have done enough. And so though it's not their responsibility, they are not the government, but they have a helping hand. They are to help. And if they are to help, they should help maximally, not just at the shadow or the shallow places as we are seeing in the country today. Then also going to the third question of the observer from Bayes University, he also goes to ask if the United Nations, if it's their responsibility, or how many percent responsibility, or how many percent can they be effective in the Nigeria sector, or how many efforts can they put? Though, just to stand on the existing facts, just to mention that though they are not the government, they have a reputation for doing this, and they should put in their best, as I just said. And the last question, as the colleague from International Relations said, the World Health Organization is a part, the health segment of the United Nations Organization. And Sorry, we did not really emphasize more on that fact. The World Health Organization is supposed to reduce the prices heaped on being able to afford drugs. $1 per day in an average Nigerian lives. $6, above $6, the price for this drugs on malaria, typhoid, tuberculosis, and what have you. And HIV retroviral drugs runs into millions. How on earth is the average Nigerian supposed to afford this? They should do something as the health segment of the UN. Thank you.
I must give respect to whom respect is due. Good day, Mr. Chairman, panel of impartial judges, the moderator, my co-debaters, distinguished ladies and gentlemen. My name is Amandi Felix, a representative of the University of Kamka, and I'm standing here this evening to propose a motion which states that prevention is better than cure. This is easier said than done. It is not what people say that matters, but what people do. Prevention is a concept that is easy said, even by the young children. But how then are people able to prevent? Ladies and gentlemen, this is a fundamental question that one should not stand to blindly oppose this motion. Prevention is the art of stopping a particular problem from existing. I have the following point to back up my argument. First, poverty. Poverty is a socio-economic problem that is affecting all aspects of the society. It entails sustained low level of income and lack of access to services like education, healthcare, sanitation, and so on. There is a very high level of poverty in Nigeria. More than 60% of Nigerians are living in abject poverty. Ladies and gentlemen, and particularly my dear opponents, in the face of abject poverty, how is it possible for people to have access to good preventive facilities? How? I need an answer, though I will leave you to ponder on that question. Give it a second thought, and I believe by the end you must, and I repeat, must be convinced with me that prevention is better than cure, though this is easier said than done. Next is the issue of policy implementation. Prevention will only be successful when the policy instrument is also effective. Environments that do not have good preventive policies are bound to experience disease and death. Nigeria, for instance, introduced the quarantine strategy, which helped in preventing the spread of the epidemic. Ladies and gentlemen, prevention is actually better than cure. Though without good policy implementation, it becomes easier said than done. Next is the issue of apathy/stroke fatalism. This is when individuals are generally disinterested with certain things. Individuals feel so powerless that they cannot try to change anything. This can also be justified in a religious precept. Accept this and that because the Almighty God has decided your fate. Ladies and gentlemen, several people in Nigeria today are disabled because of refusal to comply with certain preventive measures. How then is prevention easy when individuals generally, completely and totally refuse to sympathize or comply with certain preventive measures? How? I'll leave you to think about that question as we proceed to the next point, which is unethical behavior. This is another problem that is causing harm to the third world countries. It entails the misappropriation of public funds, equipment, facilities, and even public records. There is a very high level of unethical practices in Nigeria, and that is affecting the quality of service delivery, even in the health sector. Professionalism and merit is de-emphasized. Appointment and employment of medical personnel is based on the matter of who knows who. Ladies and gentlemen, the recent meningitis vaccination in November 2014 caused a lot of harm and illness to Nigerian citizens. This was as a result of the malpractice in the employment of the vaccinating staff. There is a saying that the whole does not make a monk. These people may actually be involved, yet cannot deliver the best. Ladies and gentlemen, this evening I stand here to open up clear to you that with these corrupt and unethical behaviors in the health sector, prevention will rather be scuttled. I believe with this few but elaborate point of mine, I've been able to convince you beyond reasonable doubt that prevention is actually better than cure, though this is easier said than done.
Prevention is the act of stopping something from happening.
Cure, on the other hand, is a solution to a problem. Prevention is better than cure is an adage that even a 5-year-old knows. This shows the ease of making that statement. Yet millions of people get infected with malaria, HIV/AIDS, and other epidemics. Why then is prevention is better than cure easier said, yet so difficult to be practiced? But before I continue, let me give honor to whom honor is due. Good evening, the chairman, impartial judges, accurate timekeeper, co-debaters, ladies and gentlemen. I'm Tara Mbahemafan Michel, a proud representative of the prestigious University of Mkamka, and I'm here to propose the motion which states that prevention is better than cure. But this is easier said than done with the following points. First, the issue of corruption. Corruption is like a cankerworm that's eating deep into the society, affecting her in all ramifications. Corruption, according to World Bank, is the abuse of public office or funds for private gain. You, my humble opponent, may be wondering what corruption has to do with the prevention of diseases, but let me tell you. Corruption leads to the sale of fake and adulterated preventive medications. How on earth will fake and adulterated preventive medications serve its purpose of preventing diseases? Corruption also leads to the sale of certain preventive measures that normally will be given out freely. What then happens to those who can't afford the cost? You and I know that mosquito nets were given out to health institutions to be distributed to members of the general public at no cost. But you and I know that these mosquito nets were rather sold, so those who can't afford it are left vulnerable to malaria. Health administrators may siphon millions of dollars from health budgets. What then is left for the purchase of preventive medications when selfish and greedy individuals have their personal interest at heart at the expense of the welfare of members of the general public? Obviously, corruption is one of the reasons that leads to prevention is better than cure being easier said than done. There is a clinic run by a nurse who is over 70 years old. She can barely remember what she did with the patient yesterday, says Dr. Philo Lethoya, an HIV and tuberculosis specialist in Lesotho, where 1/4 of the population is infected with HIV, the virus that causes AIDS. Yet she still runs the clinic. Let me tell you why. Lack of medical personnel. This could be as a result of many reasons, which include lack of medical institutions to enhance the training and recruitment of medical staff, brain drain, lack of resources to be able to pay medics. Lack of medical personnel leads to shortage of professional medics that carry out awareness campaigns as regards vaccination as well as vaccination processes. Lack of medical personnel also leaves as a result of lack of medical personnel, people are not aware of things that are wrong with them. So how then can people prevent themselves from diseases when they do not even know what is wrong with them? The next is the issue of neglected diseases. These are diseases that do not receive the required attention. These diseases include snow fever, elephantiasis, river blindness, etc. They affect mostly poor and powerless people from developing countries. As a result of these facts, little research and development have been attracted to these diseases as regards preventive measures. This is because they do not promise good returns on investment. As a regard of this neglect of these diseases, awareness creation as regards neglected diseases are also neglected. How then can people prevent themselves from something they are totally clueless about? Lastly, the issue of cost of preventive medications. Cost of some medical preventive medications are usually very high and unaffordable to the masses, where people know what preventive measures to take but cannot afford it. Prevention, though better than cure, becomes definitely easier said than done. With this concrete point of mine, I hope I've succeeded in convincing you that prevention is better than cure, but this is easier said than done. Thank you.
The chairman, panel of judges, accurate timekeeper, co-debaters, ladies and gentlemen, I'm Rotimi Oluwatosin Goodness, representing University of Mkamka, Benue State, here to propose the motion which says prevention is better than cure. This is easier said than done. According to the Longman Dictionary, prevention is an action of stopping something from happening or arising. On the other hand, cure is to relieve a person from a symptom of a disease or a condition. Everyone knows the adage, prevention is better than cure, yet some people will dispute this fact. Benjamin Franklin, however, quotes, "An ounce of prevention is worth a pound of cure." Nevertheless, there are various barriers to achieving effective prevention of these diseases. Such barriers include ignorance of risks. This means lack of knowledge or information about something. You would all agree with me that if you do not know about a problem, you will not take the required preventive measures to solve that problem. For example, we all know washing our hands is one of the most important steps we can take to remain healthy. Yet, we do not take such preventive measures. We frequently touch our eyes, nose, and even our mouth without being conscious of the fact that diseases get into our body through these parts. We are all guilty of this. Ignorance, however, is one of the biggest challenges that stops people from taking preventive measures to safeguard their health. Because of ignorance, prevention is easier said than done. Second, lack of choice. This is a situation where the available becomes the desirable, where the desirable is not available. For example, in Nigeria, especially in the rural areas, where there is shortage of potable water, people take in any available water, no matter how unsafe it may be, rather than die of thirst. This is because water is life and people need water to survive. In a situation like this, the United Nations programs on global health cannot reach out to all areas affected by shortage of water at the same time. So even though people may know the consequences of taking in unsafe water, they cannot take the required preventive measures of not taking unsafe water. So no matter how the United Nations programs on global health or anyone else preaches prevention as being better than cure, where there is lack of choice, prevention is certainly easier said than done. With these tangible points of mine, I believe I've been able to convince you that though prevention is important, with these points of mine, I believe I've been able to convince you that though prevention is important, it is easier to suggest than to actually do. Thank you very much.
Good day, the judges and my audience. I am Vincent Naboro, a 300-level political science and diplomacy student of Veritas University, the Catholic University of Nigeria. And I'm here to speak against the motion, prevention is better than cure, because it is easier said than done. The Oxford Advanced Learners Dictionary defines prevention as any action or measure taken to stop or to make impossible an occurrence of a phenomenon. The definition of cure, taken from the same source, is defined as a remedy or a solution for a problem that has already occurred. Now, on an opening note, man by nature is very rebellious. Martin Wright of the realist school of thought stated that the most dangerous sin of man is the instinctive lust for power and the desire to subdue each other. This is what makes international relations the struggle for power. Take, for example, after the First World War of 1914 to 1918, the League of Nations was established as a means of combating or preventing the occurrence of another world war. However, during the years 1939 to 1945, another world war occurred which had more devastating effects than the First World War. It led to the use of a nuclear weapon to clear out a whole region or a whole country in Hiroshima and Nagasaki that still has health implications to date. Now, this begs the question, if the implementation of or the bringing about of the League of Nations could not prevent the occurrence of another world war, how would the implementation or the establishment of the how has the United Nations helped or aided in stopping the various terrorism uprisings going on in countries today? Furthermore, prevention cannot prevent or cannot stop or avoid economic decay and underdevelopment. This is further buttressed by the point that it is not about bringing about policies or establishing agencies, ministries, or other faculties that will help to prevent economic decay, but it is the willpower and the zeal and the rigor